How do we as individuals help someone like open up more, or how should we support them when they're experiencing like a mental illness?
It's a great question. I think one thing I hear a lot from my patients is that they do try reaching out to friends or family, and that they don't like when people try to like problem solve or just, they'll be trying to tell people what they're going through, and immediately the person will interrupt and say, "Oh, you should do this, you should do that, you should snap out of it." Another myth about psychiatric illness. And so they feel very kind of unheard and unsupported in that moment. So I think one of the main things to do as a friend or family member would be to kind of listen and try to understand what the person's going through and feeling. And then if, as time goes on, if you're able to kind of help them, get the help they need, like connect them with things, that would be great. But don't just start right off with that. Because I think that can be very off-putting if you're trying to tell someone about something you're going through and they interrupt you to try to problem solve. It's not helpful. So use your listening ears as much as you can in the beginning. Let's see, other things with friends and family members. I think being really kind of understanding, not thinking it's due to the person's personality, or even if they have a personality disorder, like that's treatable. like go easy on a person. Sometimes people think like, oh, this is like a moral failing that you're having this, and the snap out of it mentality, like I mentioned, all of that can be pretty hurtful to the person who's struggling with a psychiatric illness. For people with substance use disorders, especially, taking a very kind of warm and understanding approach can be helpful, because in our society, unfortunately, there's just so much stigma around that. Like if we think of psychiatric illnesses like more like depression and anxiety, there's stigma around that, but then substance use disorders, there's even more. So, instead of being like, this is your fault, you're behaving really badly, because, it's really, a lot of it can be explained by the substance use disorder, which is a brain disorder. So taking a very kind of understanding, soft approach, and sometimes even asking the person, like, what can I do to best support you right now?
Tying this back to the pandemic, obviously a lot of healthcare providers are turning to things like telemedicine since they can't like physically meet with their patients. So we just have a couple questions. So like, first of all, how has this pandemic changed the way that you operate and the way that you communicate with your patients? And also, how can someone seek access to treatment or to their healthcare provider if they're experiencing mental illness?
Okay. Our clinic changed dramatically in March. So we were doing all in-person visits. And then in mid-March, we switched to all Zoom visits, essentially, like overnight. So it was quite dramatic. It has been a really good learning experience. We've always thought it might be useful to do some telepsychiatry like this to improve access for some patients, though I understand for some patients it makes it harder if they don't have like internet access or like a good internet connection or a computer. We thought about doing this, but to do it so rapidly was pretty dramatic. I think on the whole, some patients have really liked it. And we are finding that people are using more of the online messaging system to be in touch with us instead of calling, just because they're getting hooked in anyway to get onto Zoom. So it seems to be making the whole system, from my end, a little bit more efficient. I also sometimes like being able to see patients in their houses, and like they give me a tour and kind of I get to see a little bit more about them than if they were just sitting in the office with me. Now, that being said, with psychiatric illnesses, there are some patients for whom we do need to see in person, and so we do that with a discussion of the risks, and with both of us wearing masks and socially distancing and being really mindful about our cleaning protocols. But it has really changed the face of psychiatry. Like across the country, people have changed rapidly to virtual visits and phone visits. And I think, there are some advantages. I think there are some patients for whom their symptoms are so severe that it's hard to get out and come and see us in an office building, but they can pick up the phone, or they can log on to Zoom. And so, one of the things that we want to do in our field is try to get access to as many people as possible and help as many people as possible. Like rural areas in Missouri, for example, they weren't a lot of patients weren't able to drive in and see us. It was too much of a hassle, and so or too challenging. So now we can maybe get access to working with them. I think many people, they do start with talking to their pediatrician or to their primary care doctor, and often if it's something like a little bit more like bread and butter, like a depression or an anxiety disorder, often the pediatrician and the primary care doctor can start the process of getting medication, maybe getting you in to see a therapist, and then putting in like a referral for a psychiatrist if needed. If you just wait to see the psychiatrist to start medicine or to start treatment, that could be a long wait during which time you're suffering a lot. And a depressive episode, we know, or a severe kind of psychiatric disorder can really impact your functioning and impact a lot of things in a person's life. So I'd encourage you to kind of start with the primary care doctors. And then as far as kind of going forward, as far as finding a psychiatrist, many people go on their insurance website. People use a website called psychologytoday.com and look for kind of psychiatrists and therapists on there. People go on the SAMHSA website. I think that often will connect you with care. They're pretty good about connecting people with substance use disorder treatment as well. Other strategies. I think kind of calling around town, seeing who's taking new patients, but understanding there can be a long wait. Once you start a psychiatric medicine, sometimes it can take 4 to 6 weeks to kick in anyway. So again, if you can get things started with your primary care doctor, that's get you feeling better as soon as possible.
Awesome. So that's all we have for you today. Thank you so much for getting on this call with us and answering all of our questions.
And do let me know if any other questions come up down the line. You can always drop me an email. It's great to meet all of you. Really like NAMI, so I'm glad that you're involved with your school's chapter. And I think just take care of yourselves at this very difficult time, to take care of each other, because it is a hard time. I would not underestimate that.